Hey everyone, this is Deepu Gowda, Course Director for Foundations of Clinical Medicine Tutorials. I just want to spend a few minutes talking to you about the upcoming SimCenter PE sessions. First of all, make sure to check CourseWorks or Oasis for your schedule. Each group of 4 students is scheduled for a 2-hour time slot. They're there together that whole 2 hours. Please get there 15 minutes ahead of time. Check in at the SimCenter and then just wait in the debrief room or the conference room right next to the SimCenter in the basement down there. A few of you are in groups of 2, as you know, this semester. So groups of 2 will be paired with other groups of 2. So just look for your schedule. Your ABCD determination is going to be based on your last name again. If you're in a group of 2 that's not paired with someone else, basically what's going to happen is each of those students will have a half an hour physical exam experience where the other student watches and then they switch. Let me go over a few tips that may be useful. Check out the maneuver checklist on CourseWorks for the session. Those are the maneuvers that you will get to do on Thursday and Friday during your session. Please commit the sequence to memory, and you will be expected to have practiced before you get to the SimCenter. So the SimCenter is not a place to show up and be expected to be taught the maneuvers. It's really a place where, especially this session, where you're going to have expected to have practiced these maneuvers on one another, visualized them, and then show up to the SimCenter with the intention of then performing those maneuvers with the standardized patient. A quick note on the maneuver checklist where it says think aloud. What that means is for, some physical exam maneuvers involve observation. For instance, on the oropharynx exam, one of them, maneuvers might be examine the oropharynx, examine the dentition, examine the tonsils, etc. Now, as the standardized patient and as the faculty member, we can't know what you're observing because observation is an internal process. And so to externalize that process, what we're asking you to do is think aloud. Basically, say out loud what it is you're observing. You don't have to tell us exactly what the findings are. Just the process of what you're observing is sufficient. If you want to tell us the findings, that's also okay. So for instance, while doing the oropharyngeal exam, you would say aloud, now I'm examining the dentition, looking for any caries. I'm examining the posterior oropharynx, looking for any exudates or erythema, examining the tonsils, looking for any enlargement or exudate, etc. Hope that makes sense. Other tips, please wear your white coat, bring your tuning fork, visual acuity card, stethoscope. If you have a Panoptic, bring that. All the rooms there will have a blood pressure gauge. They will have a coaxial ophthalmoscope as well, the direct. So you're going to have that already present in the room. So how does this session work? 4 students will be present for a 2-hour segment. And student A will start in the first half an hour as the examiner, then student B, then student C, then student D. So the half hour is split up like this. The first 20 minutes or so is going to be the student performing the maneuvers. They're not going to have a checklist in hand. The checklist is going to be something that they have learned ahead of time and practiced. So remembering the checklist in your mind, you'll be performing the maneuvers in that same sequence off that checklist. And then you'll have a few minutes to get feedback from the team and from the standardized patient. And then hopefully a few minutes for the standardized patient to take a break, take a breather before the next student starts. And in that way, we'll have 4 cycles for the 2 hours. The standardized patients will have already met with either me or Dr. Kessler earlier in the week to have done training. They will have at least an hour or 2-hour training on the mechanics of the physical exam maneuvers and thinking about common pitfalls and how to give feedback. Most of these standardized patients have done this with us in the years prior, so last year or the year before, so they will actually have some experience in these particular maneuvers and giving feedback. So most of them will not be new to this. The standardized patients will focus on feedback regarding the mechanics of the maneuvers as well as the sequence. They will not have any experience giving you clinical correlations. Some of them will give you feedback in real time. So they may actually guide or correct your physical exam maneuvers in real time so that they don't have to remember all the things to give you feedback on later on. Just be prepared that you might be interrupted a few times. So what we want you to do, let's say you're student A and you're starting off the session, knock on the door, come on in, use Purell, clean your hands, introduce yourself, say your name, say your role and what you're there for, ask them what their name is, and then proceed to perform the maneuvers. Now, each student will have a different role. So the first half an hour, student A is performing the physical. Meanwhile, student B is in the room with the maneuver checklist. And they are keeping track of what student A is getting right and not performing in an accurate way or forgetting to do it. Student B can also be asked to serve as an occasional coach. Okay, so in the rare situation where student A might forget what to do next, student B, student A can ask B, "Oh, what am I supposed to do next? I'm kind of blanking." And student B may say, "Okay, why don't you move on to the lymph node exam?" Student C and student D, meanwhile, are standing outside the room, looking through the mirror and with their own checklists. Student C has a communications checklist. Check that out. That's also on CourseWorks. Student D has a teamwork checklist. Please check that out. That is also on CourseWorks. All right. Here is a page from the checklist. Okay, this is the first part of the checklist, just purely about the approach. Did you give good instruction? Did you maintain modesty? Did you introduce yourself? Use hand sanitizer, etc. As you move on in the checklist, it goes on to general observation, your general appearance. Did you do a think aloud about that? Did you think aloud about the consciousness? And then you go on to various parts of the physical exam. Goes on from vitals and then moves on to HENT and then goes on to cranial nerves. We also want you at the very end of your 2-hour session. Okay, so each half an hour is going to, you'll cycle through each student in this way. At the very end of the session, at the end of your 2 hours, the standardized patient is going to set aside at least 5 minutes for the whole team to reflect on teamwork and professionalism. Okay, so that teamwork checklist is already in your CourseWorks as well. And the whole team is going to lead a reflective exercise thinking about how you guys did as a group. Were you punctual? Were you prepared? Were you dressed professionally? Did you bring the necessary equipment? Were you engaged? Were you paying attention? Did you have a desire to learn? And did you support your peers? Were you really observing closely and then giving really detailed and constructive feedback? Or were you kind of zoned out? And with respect to feedback, were you open to the feedback you were receiving from your classmates? Okay, so those are all aspects of professionalism and teamwork. And then think about, well, here's where we were. What can we do to improve? Because if we improve this aspect of our performance, the entire enterprise improves. You guys strive to perform at a higher level so that you can serve your patients in higher ways later on. So I hope that that was useful in terms of thinking about the SimCenter session. The last point I want to make is about the Northwestern module on oral case presentation. This is on CourseWorks also. We want you to do this before next week. So if you want to wait till the weekend, that's fine. If you want to do it on Monday, that's fine. But you're going to need to do this before showing up to the oral presentation session next week. We're giving you plenty of time to get it done. The URL is here. The URL is also on CourseWorks. This is an interactive module, and you need the latest version of Flash to do it. Okay, so unless you download the latest version, it will not work properly. So if for some reason it's not working well, just make sure you download the latest version of Adobe Flash. This is a module that Northwestern has created. There are colleagues, they have given us permission to use this. It takes about 2 hours to go through. So if you want to do it over the weekend or early next week, that's totally okay. It is outstanding. It goes over the basics of oral presentation, and it gives you some nice strategies on how to organize your information, how to deliver an effective oral presentation. So this is part of your groundwork to be able to do this well. As an oral presenter, you are an absolutely important part of the team in making sure the patient's getting good care. Also recognize that for many students, the oral presentation is one of the most stressful parts about entering MCY. It was for me. It was very stressful for me. And looking back, I wish I had modules like this. I wish we had dedicated parts of the curriculum to help us present better. If you follow the plan, if you trust the process and do this work, you will be in very good shape to lay a strong foundation to learn this vital tool, vital skill. So enjoy this module. Please make sure to do it because we will be building on this next week. That's it. Hope this was useful to you. Please be in touch if you have questions, okay?